For your health, a deadly hantavirus outbreak aboard this cruise ship has a lot of people worried. Some are drawing comparisons to COVID-19. But how concerned should we be? Joining us now to separate fact from fear is Dr. Anne Rimoin, professor of epidemiology at the UCLA Fielding School of Public Health. Dr. Rimoin, thank you so much for being here. We really appreciate it.
My pleasure.
Now, certainly after going through the pandemic, there's a lot of trauma, PTSD involved. People really get concerned when they hear about this. Also, the fact that it's starting again on a cruise ship. But let's separate that fact from fear. How does hantavirus spread? And then also, should people be concerned about this person-to-person transmission?
Well, Lynette, thanks for having me. And of course, it's very, very nerve-wracking for people to think about a serious infectious disease. But I just want to point out an infectious disease that's serious doesn't necessarily mean it's a threat of a pandemic. What we're seeing here is a disease that spreads first from rodent droppings or urine or saliva to a human. And then in this case, this very specific hantavirus, we do see some chains of transmission. So your question, should we be worried about transmission? We don't have that kind of hantavirus here in California. We have the kind that just passes from human or from the droppings to humans and dead end. And there is very, very low risk of seeing cases here in the United States of the Andes virus.
What about the people who got off of the ship before they knew that there was the hantavirus spreading? Those people got off the ship. Some of them are back here in California and in other states in the United States. Is there concern about that because of the incubation period, right?
Well, there's a very long incubation period for hantavirus, for the Andes virus in particular. It can be up to 6, 7, 8 weeks. But the good news is we don't have any evidence of transmission prior to having symptoms, and we don't have any information about anybody having symptoms off of that, who've come off of that ship. So I think the key is that the people who have come off that ship have been identified. They're going to be watched for symptoms. And so the chances are very, very low that we'll see any onward spread.
A lot of people traveling this summer, and this is the season for all this travel. What steps can people take to protect themselves, whether they are traveling or maybe just in everyday life?
Well, when we're talking about, like I said before, we have hantaviruses. We have hantavirus here in California, and to prevent hantavirus, the best steps are, if you're going to be cleaning in rodent-infested areas, make sure you wear a mask, make sure you disinfect the area, you ventilate it, because you don't want to have spread, you don't want to aerosolize those particles, which can lead to it. But I think that the risk for traveling is very low. People ask me, should I go on a cruise? I don't think that this has any major implication for a cruise. If you're going on a cruise, things you worry about are norovirus or respiratory pathogens, those things, good hand hygiene. If you're in really crowded areas and there are people who, lots of people together, you can always put a mask on. But in general, I would say that this is a very serious event for the people that have been in very close contact, very low risk to the general public. And people should not be so concerned about this as a general issue, but really serious for those people that have been exposed.
We so appreciate your insight, Dr. Anne Rimoin, professor of epidemiology at the UCLA Fielding School of Public Health. Thank you so much for being here this morning with us.
My pleasure.
At 6:40.